Hippocrates, the father of medicine, once quoted, "There is a natural force within each of us which is the greatest healer of all disease." Hi all, this is Dr. Amala, and today we are discussing on this natural force, our immunity. When we say Hippocrates has quoted it, we understand that the concept of immunity dates ages back. But wait a second, Ayurveda, which is still more ancient than this modern medicine, has mentioned about immunity, as there is some force which is helping us overcome the disease if we get infected or help us prevent the risk of getting infected. And we have called it Vyadhi Kshamatva, Ojas and Bala. All of a sudden, there is a big curiosity about the immunity and how the immune system works. With COVID lurking out at the stretch of our hands, people are just wondering at all the things which can help them prevent the risk of getting infected, or if they get infected, to overcome it in a healthy way. According to the statistics, out of 100% of the people infected, 85 people overcome the disease in a healthy way. 13% overcome the disease, but they may develop some complication. 2% succumb to the disease and lose their life. With the statistics rising exponentially, it has been said that within a span of 2 to 3 months, there is a chance that 80% of us may be infected at least once to this COVID virus. So, our aim should be to fall in this 85%, that is, to overcome the disease in a healthy way. Every day we open up the social media, we see advertisements telling us how immune system works and what is the best way to improve our immune system or boost your immunity. But is it really necessary to boost your immunity? And what is immunity? Before we understand how we have to boost or improve our immune system, we should understand what immunity is. We have a very big definition, which is immunity is a condition of being able to resist a particular disease, especially through preventing development of a pathogenic microorganism or by counteracting the effects of its products. But to put it simply, immunity is nothing but the driving force which helps us survive in our immediate environment and to survive in that in a healthy way. And to know how it does it, we should know the classification of immunity. Basically, it is coming under two classifications, the innate immunity and the acquired immunity. So, as the name suggests, innate immunity is there within all of us. All of us are born with it. Example, we have our skin which is acting as a physical barrier that provides us protection from any invading organism. But what happens if there is an injury to your skin? Through that injury, a pathogen can enter into your circulation. So at that moment, the part of innate immunity, the cellular defense get activated and the immune cells through the circulation reach the site of invasion and destroy the pathogen, keeping ourselves safe. But is innate immunity sufficient to keep us safe? No, because it is not specific to different pathogens. It's like your general security guard for your body. For very specific immune response, we need the acquired immunity, which we acquire in our lifetime. So there you have it actively and passively. In the active way, you can acquire it naturally or artificially. Example, we all know if we get an episode of chicken pox, we will not get the disease again. This is a way of naturally acquiring active acquired immunity. Also, all of us would have gone through a schedule of immunization when we were young. So that is the way of artificially introducing acquired immunity in your body. Then we have passively acquired immunity, which also comes in two ways, the natural way and the artificial way. The natural way of acquiring passive immunity is through mother's milk. It is called temporary immunity or borrowed immunity. When we are born, for the first 6 months of our life, our body is not capable of producing antibodies. So, at that time, to help us stay safe, we take in the antibodies from the mother through the breast milk. So, this is the importance of exclusive breastfeeding in the first 6 months of a newborn's life. The artificial way of acquiring passive immunity is through certain medications which we take for specific conditions. This is a gross way of understanding your immune system and immunity. But the question in hand is, do we really have to boost our immunity? Will it protect us or will it harm us? To know that, stay tuned for the next video. Till then, it's bye from Dr. Amala. Thank you.